Welcome, everyone, to a special night, a special conversation, a special time, a special moment. Welcome. Before I do anything else, you know what I'm going to ask you to do. Hit that share button. I'm telling you, you do not want anybody to miss tonight. Yes, so hit that share button. So welcome to Refuge Church of God's conversation. I am Pastor Kev, the senior leader of Refuge Church of God right here in Bed-Stuy, Brooklyn. I'm so glad, I'm so excited and delighted that you have chosen to carve out time to join us on tonight. We are demystifying the COVID vaccine. So listen, this is what we're going to do. If you have any questions at all, you can put it in the chat and hopefully we will get it to you. That's why we was asking you to do it early. We got a whole bunch of questions. Listen, we are so excited. Let me just get straight to it. We have a wonderful person, Dr. Nicolette Louissaint. She serves as Executive Director and President of Health Care Ready. I know you may be saying to yourself, what is Health Care Ready? I am so glad you asked. Health Care Ready is a 501c3 organization that focuses on strengthening the United States healthcare supply chain preparedness and response before, during, and after natural disasters and disease pandemics. Healthcare Ready also serves as a critical component between the end-to-end supply chain and government partners at the federal, state, and local government level. Prior to this role at Healthcare Ready, Dr. Louissaint served as the senior advisor to the U.S. State Department's special coordinator of for Ebola, which means this was during the height of the Ebola epidemic of 2014. And in that role, she was responsible for coordinating international efforts and jump-started the diplomatic response to the epidemic. Listen, she got to that position because she has an MBA from the University of Baltimore, a Bachelor of Science degrees in Chemical Engineering and Biological Sciences from Carnegie Mellon University, and a Ph.D. in Pharmacology and Molecular Sciences from the Johns Hopkins University School of Medicine. She has also completed postdoctoral fellowships at the Johns Hopkins University and the American Association of Science. Listen, I can go on and on and on, but you can read her bio and all the wonderful things she has accomplished and continues to do as an executive director of Healthcare Ready. You can check on Healthcare Ready, the website. You can go ahead and look her up, Google her. I promise you, you will be blessed. Ladies and gentlemen, my brothers and my sisters, my fathers and my mothers, please let us welcome our very special guest, Nicolette Louissaint, Executive Director of Health Care Ready. Ladies and gentlemen, put those emojis up, clap your hands. Here she is, live and in living color. Welcome, Doctor.
Hello, Pastor Kevin. How are you doing?
Listen, I am doing wonderful. Thank you so much for joining us today. Listen, while she's here, I just want you to know we are so proud of her. She is also the daughter of some very great members of our congregation, Brother Burton and Sister Andrea. We want to just say what a wonderful privilege it is to have you as our guest tonight. So thank you so very much. We have some questions for you, and we know around this COVID-19 vaccine, we thought about how can we demystify this kind of flair and kind of myths around this vaccine. And the only person we can ever think of was you. And we know that the CDC has just talked about how if you are vaccinated, you don't have to wear any mask. So let me just get straight to it. One of the questions that we have is, it seemed that these vaccines came on the market very quickly. Mm-hmm. How were they developed so quickly?
So first, I want to thank you for having me. Always nice to be with my home church. For those who don't know me, I was literally born, raised in Refuge Church of God. So always nice to be home, always nice to be of service to my home church where my parents and my grandaunt still continue to worship. So the question about where the vaccines came from and how they were created, it's important to take a step back and understand that while COVID was not something that we knew was coming, in many ways we knew COVID was coming. So this is a pandemic. Like other near pandemics, we've heard a lot of people talking about the Spanish flu of 1918, and we have pandemic preparedness plans. And a big part of how we, as a government, as a nation, but also in the international community, talk about and prepare for these types of events is understanding that we would need to create medicines quickly. Because the thing about COVID is, it's coming, but you're not going to know what type of virus it is until the pandemic starts. And so with that, there are frameworks and there are plans and there are tools that have existed for decades, actually, that have been invested in research and have really been longstanding, designed to make sure that when we get to this point, because we got here now, we know we'll get here again at some point in the future, we will need to make sure that we can produce this type of a vaccine. So that's where they came from. It's not, as if they just dropped out of the sky or there was no research going on or there was no plan for how you would develop it, how you would test it. Those things have been in the works for about 25 years.
Wow. So you're saying for 25 years, this whole vaccination has been in the works for 25 years.
Yeah. So I mean, when you, without getting too technical, for people that are in the field, we anticipate that we focus on pandemics and hurricanes and things of that nature so that the average person doesn't have to think about that. But a part of that is making sure that there is infrastructure that is set up to make sure that when those things happen, we can do the research, do the development, do the testing, do the trials to make sure that we can create medicines quickly and then roll them out to the globe as we're doing right now in the middle of a crisis.
So now, how do you test them? Do you test them prior to the pandemic or while we are in this pandemic? How is it tested?
So if you go back to about November of 2019, that's when we began to hear that there were outbreaks that were in China, specifically in the Hubei province in China. China began to do lockdowns in December. That at that point, there was a lot of discussion about how are we going to get the virus or get the sequence. So there are a few different ways to think about pandemics. It's basically we can have a disease outbreak of something we know, like the flu, or something we've never seen before, like COVID. And so when it comes to COVID, we needed to get the sequence to say, this is how we're going to be able to understand what type of virus it is. And that's when the researchers around January began working really hard to make sure that they could understand how to take whatever we already had and design a vaccine that would be very effective. So a lot of that, all of those decades of work fed into, now that we know exactly what we have and what we need to fight against, now we will start the work of getting everything in place. So January 2020 was when it really kicked into high gear. And then the clinical trials began around late February, early March.
All right, great. For us who may be just sitting back and looking out, may have no idea of all the work and the science and the preparation. I know I'm a pastor, so I can't help myself. Even Jesus tells us that we ought to be ready. We know he's coming back. We know he's coming. So just like that the coronavirus was coming, that COVID was coming, you was preparing yourself. So we know that Jesus is coming back. So we have to prepare. It's like the 10 virgins, 5 was wise, 5 was foolish, because you don't know when, but you know that the bridegroom is coming. So you prepare for the delay so that when he does come, you'll still have some more oil in your lamp to prepare yourself for his arrival.
Exactly. Right. And that's the principles. None of the principles are new. The idea is that we should be exercising wisdom in how we go about. I think there's a slight echo. I don't know if it's on my side. This is what always happens with technology, right?
Yeah.
But
we're not hearing.
We're working. Echo. Okay, great. We're not hearing. As long as you're not hearing it, we're good.
So you can go ahead.
So, the idea is that if you wait until the pandemic to say, hey, what are we going to do? You're already behind. And at the goal at the end of the day, when we're talking about stopping a pandemic, we're talking about saving lives and preventing people from getting sick unnecessarily. That's the only goal here. So if every time we delay, every time we don't have a good plan in place, every time we're not exercising wisdom and how we are managing precautions, whether that be disinfecting and sanitization of spaces, or how we get vaccinated and when we get vaccinated, we are not exercising the wisdom that is available to us to make sure that we are not causing undue harm to ourselves or to those around us.
And we just thank you so much for this information. I gotta go here. I really gotta go here. I pastor literally 100% of African American men, men and women of color. So how? So here's the question: is it really safe for people of color?
Why would it not be safe for people of color?
Again, we look at Tuskegee experiment, we look at all these things, and we see commercials with black and brown faces, and it's always trying to come into our community and get us vaccinated. So we have this kind of
So I think there are two things at play. There's mistrust that comes from a place of historical understanding, right? So I will be honest and say I think there are a lot of people that are referencing Tuskegee that don't actually have a full understanding of Tuskegee or what happened, but different story for a different day. But there also, I think, a lot of places of mistrust that are rooted in misinformation. The information that's coming out of, who knows where, that's moving through WhatsApp and moving through Facebook, that's just simply not accurate. And I think those are two different things. When it comes to misinformation, my posture is a little bit different. I think if you're asking questions, related to the vaccine, the safety of the vaccine, whether or not you should take that vaccine, that should come from a trusted medical professional. And that is not the same as the very valid concerns related to the history of medical racism and the creation of medical mistrust because of the ways that Black and brown bodies were treated historically in the pursuit of medical research. So what I'll say to the latter is that when it does come to understanding medical research, first and foremost, it's important to understand, like every other system and institution, the system of medical research has evolved significantly over time, specifically as it relates to how the protections are put in place to protect people of color and to protect the most medically vulnerable who we need to be involved in clinical trials. There are ways that we go about making sure that individuals who sign up for a trial are protected, their rights are enforceable, but also that there are regulations that are in place every step of the way, so that whether it be thinking about what the researchers are able to do, how the data and how frequently the data is analyzed, how we test for safety, what parameters we're looking for, all of those things are actually very tightly controlled by both federal, national, and international standards, laws, and guidelines. So things like Tuskegee, for those who actually know it and fully understand it, would be illegal today. And I think it's important that we understand that while we, going back to your, example and thinking about it in the framework of the church, we don't compare the church of 2021 to the church of 1800 without acknowledging the systemic and institutional differences that existed then and that cannot and do not exist now, whether that be related to the treatment of women, the treatment of children. All of those things are radically different. It is the same when it comes to clinical research. The difference when it comes to how we think about trials is that first and foremost, we are looking to do two things: measure safety. Before we actually look at how well something works, we look at how safe it is. And so what that means is that really the first phases of a trial, they're interested in collecting efficacy data, and that just means how well it works. But the priority is safety. And if at any point there's an indication that it's not safe, the trial is stopped. It's that simple. So the goal is to make sure that we're doing that in the most diverse population possible, so that we're not waiting until the vaccine rolls out to understand how it performs in people of color, to understand how it performs in diabetics or people with hypertension. We understand that during the trial so that we have confidence that it's not just effective, but primarily that it's safe for those populations.
Wow, that is some great information. So let me just ask this, because right now there seems to be three pharmaceutical companies that have this vaccine, right? So we have the Pfizer vaccine, we have the Moderna, and we have the Johnson and Johnson. Okay. Not that we're comparing any, but what kind of, do they go through the same kind of research? Why is it three different companies? Why couldn't it just be one, that is being the supplier of this vaccine? Can you just talk a little about that?
Sure. So we have, and globally, there are more than three vaccines, but in the United States, there are three vaccines that have been approved for distribution. There are a few reasons that we have multiple vaccines. First and foremost, we have to vaccinate the globe. And in order to do that, you can't rely on any single product. You need as many vaccines that are safe, that are effective, that can be produced for the billions of people that need vaccine as quickly as possible. So that's one. That's why we have many. Two is that viruses are tricky things. Something that all scientists would tell you, most people don't think about. Viruses are not actually living things. And what I mean by that is that a virus needs a host to survive. So as we're talking about how we stop the pandemic, we have to actually slow the spread, the transmission of the virus. And what that means is that you really can't just rely on one type of anything to treat or prevent the virus from moving. And so when we think about why we need multiple vaccines, Part of the reason for that is because having multiple vaccines gives us more chances to be able to stop the virus. So we're hearing a lot of discussion about variants right now. And also you'll hear in the news questions of how well does this vaccine perform against this variant? And that's because in order for the virus to continue to move through the population, it's mutating. And when it mutates, it may be recognized by the vaccine, it may not. That's part of the reason we're probably going to need boosters soon. So there are all of these things, everything from production. I personally think that it is better for us, if we're stopping a pandemic, to be able to have many different vaccines. It also means that different medical populations who may be allergic, for example, to a component of one vaccine may be eligible to get another.
So now I know that's a great question, because there are some people who have side effects and others don't. Can you just talk about that? What would be like, what are the ingredients that can be in a vaccine that will create side effects in one and not the other?
Sure. So I think there have been two sets of concerns. One has been people who think that they may have an allergy to the vaccine. Most of these vaccines are actually very simple in their components. I liken it to people who've asked questions about the flu vaccine. My mother actually has a very severe chicken allergy, and as a result of that, really cannot take most flu vaccines. And she's able to tolerate the Pfizer vaccine, the Moderna vaccine very well, because it really only has about 4 components. It has the actual mRNA, which is the actual coding that is going into the cell and giving you immunity. Has what's called polyethylene glycol, which is protecting that mRNA. It has saline. And if you have an allergy to saline, we should talk about other things. And it has sorbitol, which is basically a type of sugar. So, you can list out the components, but really those are the 4 components that are really in the vaccine. So it doesn't have preservatives in that way, which is why it's kept cold until you're vaccinated. It doesn't have a lot of additives. It really is pretty simple in its components. So allergies to the vaccine so far have been pretty low because of that. Now, the side effects from the vaccine, you'll hear a lot of people, especially those who got one of the mRNA vaccines, so either the Pfizer or the Moderna, say that, sometimes after the second vaccine, they felt tired. They felt like they got chills. They were down for 36 hours. There are a few reasons for that. I know for example, as a medical professional, have to get the flu vaccine every year. Some years, I'm fine. Other years, I'll have a fever. I will get chills. That's your immune system responding. I hear a lot of people tell me, they don't get the flu vaccine because it gives them the flu, which is actually impossible. But what it is doing is it's causing your immune system to respond. So even when we think like we have a cold and we're identifying symptoms, those symptoms are actually not from the cold itself. Those symptoms are your body telling you that it is doing the work of fighting this thing off. So what do I mean by that? We talk about getting sick or having a cold. There's some things we always think about: a fever, chills. We'll talk about muscle soreness. We'll talk about fatigue. All of that is actually your immune system. When your immune system is mounting a response, those are the things that your body begins to feel. And so as a result of that, when you get that dose and your body is building immunity against COVID, your immune system is starting to mount that response. You may feel some of those things. I've said for many people, they find that if they take an aspirin or ibuprofen right after they get that second dose, and just plan to, have an easy couple of days, drink some water, get a little bit of extra sleep, they'll be just fine. So it's not going to make you sick, but you may not feel great. And that really is all about immune systems and how individual immune systems respond.
I think that's very important of what you say, because many that I know that I speak to may
Mhm.
get the vaccine, but may not necessarily talk to a medical professional in terms of, if something adversely may have happened to my body, what should I do? So
Mhm.
we're listening to people who don't have the expertise,
Yeah.
and this is what creates and intensifies and
Mhm.
heightens the
Mhm.
fear. So,
Yeah.
so yeah.
There are a lot of Facebook doctors and Facebook scientists that are out here describing what's really happening with the vaccine. And, it's interesting because I think part of it is a desire to be helpful. I think it's rooted in something that is well intended. But I think what ends up happening is without the right context and without the right guidance, it becomes misinformation, because one person feeling a certain way is not really an indication that the vaccine didn't work, that they got sick. The other thing is that a lot of people are forgetting that it's allergy season. And
Hmm.
so they're going to get their vaccine. They may not be taking the medicines that they would normally take for their allergies. And then they're feeling symptoms and then realizing, oh, wait, I didn't take my Zyrtec.
Wow.
So all of this to say, I do take it very seriously what the side effects may be. We know that for the vast majority of people across the globe, they've been a little tired. Some people have reported chills about 12 to 14 hours after that quickly resolve. Some people have reported a light fever. But for the vast majority of individuals, regardless of age, regardless of chronic conditions, regardless of race, who have taken the vaccine, they have had mild symptoms that have all resolved within 48 hours.
That's great. Thank you so very much for clearing that up. Now,
Mm-hmm.
you have mentioned something earlier, that you have to take the flu shot every year, right?
Mm-hmm.
So those of us who are fully vaccinated, right?
Mm-hmm.
Do we have to, and I know you talked about booster shot, but how long does, let's say, the vaccination last?
Right.
Do you foresee us having to take, this every year, or
Mm-hmm.
twice a year, or twice a month?
Yeah.
Can you just
So
please expand on that?
there's still a lot of research being done to give exact clarity as to what the guidance is going to be, but um right now it looks like it'll be about 6 to 8 months before we would need booster shots, which actually means by the time we probably get through vaccinating most Americans, it'll be time for them to get their boosters, which will be interesting. But part of the dynamic that we're balancing here is the faster we can get everyone vaccinated, the better off it is for us to actually stop these mutants from coming into the population. So when we talk
Wow.
about these mutants, that's why it's so important for everyone to get vaccinated, because what we're trying to do is make sure that we don't get to the end of this vaccination and end up with a mutant that we now need to build a new vaccine against. So a lot
Hmm.
of the boosters are being developed with the mutants that we're seeing in mind, so that in 6 months, when you get your booster, you'll have immunity against the vaccine, the virus that you had, as well as these new variants. But that's a big part of that dynamic. So right now it's looking like 6 to 8 months. And like I said, more science will come out on that. I'm anticipating that once we get past that 6 to 8 month window, we're going to be looking at doing one of two things: doing annual vaccinations, or trying to see if we can combine the flu vaccine with the COVID vaccine. And I know there's a lot of research going on right now to see if we can do that, so that instead of people having to get two shots, people can get one shot that gives them immunity against that strain of COVID and the seasonal flu.
You know, you said something very, very interesting about trying to get as many Americans vaccinated quickly as possible, so we can be ahead of the curve from mutation or even certain variants. Now, I'm not necessarily a TV person, right? But why isn't that news more widespread about the purpose, or let's say the reason why it is important for all Americans to get vaccinated as quickly as possible?
Public health messaging is difficult. Not everyone wants to hear the same message. Not everyone responds to the same message. And I think right now it's been a struggle to just keep the same guidance. So right now, what you're finding is public health departments are struggling with, how do I explain to people that the better they do with vaccinating, the more we can open up parts of the world, the less we have to be concerned about these variants. And it's just been very difficult to message. And part of that is because, honestly, we don't talk about science enough until things like this happen. And then we end up with our Facebook and, our Twitter scientists that want to tell us everything. So a lot of these concepts are very new to people. But the other thing is, and I think we have to be very honest about this, we're dealing with a society that has a significant amount of collective trauma, that has a significant and very valid amount of collective fear that's being absorbed. So the more you describe these very scary things, the more you're imposing on an already existent level of trauma that is difficult for many to process and manage. And so it's a difficult thing to both articulate the challenge, offer the questions and the challenges of what we need people to do, but also manage that fear and uncertainty that everyone is feeling right now.
Wow. That is very key. So let me ask a question. How can we encourage our friends, our families, members of our congregation, people in our circle? How can we encourage? What would you suggest for the average person to who's maybe listening right now and say, this is great information. I want to be somebody who want to not just be a hearer, but be a doer. How can I help get this safety message out?
Sure. I think talking to people about whether or not they've gotten vaccinated, having honest conversations about why they may not have gotten vaccinated, and walking people through the process. If that's, I think maybe you have a conversation with your doctor or your pharmacist. There are a lot of people with chronic conditions that have to go to the pharmacy once a month or every 2 months to pick up a script. Encourage them that the next time they go, they have a conversation with their pharmacist. They don't just have to pick it up. They can say, hey, I've got some questions about the COVID vaccine. Would you be able to answer them? So part of it is being patient with the individuals who are saying, I'm questioning it. I'm not sure if I want to get it, and talking it through, but also pointing them to other people or websites or, Facebook channels or things that can help them to understand where they can get the right information. So that's one. I also think it's important to remember that not everyone is technologically savvy. So there may be people who are looking to get vaccinated that just don't have the resources to be able to go through the hoops of clicking through the right things and setting it up, or maybe they don't have an email. So offering yourself as a resource to say, if you want to get vaccinated, call me. I'll help you. I'll help you get your appointment. I'll go with you. I'll drive you to the pharmacy. Those things are barriers as well. And we need the entire community to come together to actually tackle them, because there are a lot of people who are willing to get vaccinated, but may not have the means, the time off from work to be able to get vaccinated easily. And if they had that type of assistance, they'd be able to get it done.
Yeah, it's funny that how it's just like carrying the gospel of Jesus Christ. I want to share the gospel, but then I'm afraid that if you ask me questions, I may not know the answer, right? So it's important to not only get educated yourself, to get informed yourself, but know those experts in that field that you can refer somebody to say, hey, talk to Dr. So-and-so, talk to so-and-so, here goes a number. So you be a resource as well as also being an advocate for what we need to do to make sure we keep our friends, our family, and our neighbors safe.
Absolutely. I'm not a pastor. So if I'm talking to someone about Christ and they have questions and they go beyond what I know from my lived experience or my studying the word, I'm not going to say, hey, this is where I jump out of this conversation. So your salvation is up to you. Good luck. I'm not going to do that, right? I'm going to take them to the minister, to the pastor that can give them that information and help them with that last mile of their walk. This is no different. I don't think if we were talking in the church and we were talking about the responsibility in a community to make sure that we are talking about Christ and we are bringing people to the church and that we are leading people to salvation, we wouldn't have a drop-off point where we say, this is not my responsibility because this is your salvation and I'm saved. So I know I'm good. So I'm just going to leave that to you. We wouldn't do that. How different is this largest group project that we are ever all going to be a part of to say we have to, as a community, work together to say that we're going to uphold one another, make sure that we're holding space for people's uncertainties, their fears, their questions, and help guide them to where they can make sure that they're getting not just the information, but the treatments, the vaccine that they need to be well.
You know, one of the things that, you know, I did as pastor trying to, because right now we have moved into hybrid. We have online, but we also have in person. And so we prepare the sanctuary for social distancing measures, right? Which means we no longer have the pews, we have chairs. So we have already created that. We have hand sanitizer stations all over. We have touchless equipment in the restrooms. How important do you believe that is for a house of worship or any other workplace or even educational institution to have these things in place? Or what other things do you believe that they need to boost the confidence of people to enter back into those organizations or institutions?
Sure. So I actually did a session yesterday with Reverend Tracy Blackman from the United Church of Christ, and we were talking about what it will take for the church to get back. And I know there are many people who are anxious to get back into the church. And you know, not being funny, I think this is an opportunity for us to explore patience in a way that we have not to this point. And part of that is because we have to be patient in that we are taking through ourselves through the appropriate process and that we're choosing diligence to make sure that we are not causing, again, undue harm. Part of that is having conversations about what does it look like to require vaccinations? Is that what the church wants to do? Is that what schools want to do? You've seen a lot of schools, specifically universities, say you've got to be vaccinated if you're coming back in the fall. Is that for the church in particular, is that a decision that the church is prepared to make? Who do you push out if you decide that some people are going to be excluded based on vaccination? And then you have the questions of how do you sanitize? How do you disinfect the space? How do you make sure that not just between events, but during, microphones that are being handled, things of that nature? How do you do that kind of continued cleaning? That is not my expertise. That's something my father knows better than anybody I know. So I leave that with the expert. But there are also questions about how you screen going into the space. Are we doing temperature checks? Are we doing wellness checks? Are we filling out questionnaires? Are we getting everybody's contact information before they actually come into the space so that if there was a positive case, we are able to contact everyone and let them know that they should get tested? Are the leaders of the church going to be tested on a routine basis? Because a lot of us forget that just because we're vaccinated doesn't mean that we may not test positive for COVID. It means that we won't get sick from COVID. So if we're around somebody who's not vaccinated, we could pose harm to them. So our senior leader is going to get checked. Schools are going through the same question of, will the teachers be getting tested on a routine basis? How are we doing these random tests and screens? There's a lot of questions. And I think there is an opportunity for the church to continue to challenge themselves on where is the church? Are we so connected to the physical building that we are relinquishing our responsibilities as the capital C church until we can get back into that building? What does it look like for us to still be the collective church, even as we are working through the process of getting back to being all in person? I spent more of my life at 595 Quincy than I think most people have, right? And even for me, I challenge myself on what does it look like to go back into church? Because the other thing about going back into worship is you also have to think about who else is going to be there from the vantage point of how full can the church be? What am I doing in terms of how I'm getting to church? Am I taking public transit? Am I driving? There's a lot to
A lot
consider.
to
And I
go in.
think there's a process that we can go through and begin to explore now that we are starting to get vaccinated. But I think there's still a charge to make sure that we are not relinquishing the responsibility of being the church while we're not physically in the church.
And that's important, because I think as a pastor, it's my responsibility to not only feed the people, but to also keep them safe. So, we talk to experts. We even dealt, we didn't hire him. We should have, but, your father helped us tremendously about connecting us with people who can help us sanitize and disinfect, educate us on the difference between sanitizing and disinfecting. And I think a lot of church leaders need to as well educate themselves. It's not that quick of just rushing back into the building, but what does that look like? How do you prepare your edifice, your building for that? Now, I did it because I do know that there are people who still like the physical presence, still like to come in. Okay, and there are some who's just going to stay just like you and I are talking right here and get the full experience, and they are good with that. And I got to understand it. And I think other leaders have to do that. So what I did, I spoke to experts, I spoke to people, I've consulted with people. What should we do? And your father was one of them. So what we do when people come in, there's one way that they come in. When they come in, we get their information. Who are you? Your contact information. We check your temperature, and then we tell you to go inside of the sanctuary and prepare yourself. If it's one person, you sit in a one-seater. If it's a family of three or a family of four, you sit there. And then there's one. So as you come in one way, you leave another. You leave somewhere else. So you're not the same place you come in is not the same way you exit. So we have prepared our sanctuary that. But you're right. Now I'm saying we can't protect you for how you get here or how you exit, but while you're here, we have measures in place that while you're here, we're going to keep you as safe as possible. Okay. So
Right.
I want to just ask this. I mean, time is running out and this is so great. I can talk to you till, next week, but we know you got lives to save, visions to do, people to but I need to ask you a question, because we know that you just talked about exercising patience, right?
Mm-hmm.
We are so anxious to get back. And even our president said that by July 4th, we can have barbecues, we can,
Mm-hmm.
and those who are fully vaccinated no longer have to wear masks and all of that. Can you just speak to that? Do you believe that us as a nation are so anxious to get back that we still may not be prepared and equipped even within ourselves to do that?
Absolutely.
Can you just speak towards that?
Absolutely. I think there's a desire to get back, and what President Biden is shooting for right now is a 70% target. He wants to have 70% of American residents, anybody who's here, having at least one shot of a vaccine by July 4th. And it's going to take a lot. We're around just under 35% right now. So from May 13th until July 4th, the charge is how do we get at least one shot in arms? And that's a tremendous challenge. And I think part of what has been used as the motivator is the faster we can vaccinate, the more we can go back to normal, the more we can have barbecues, the more we can, send our kids back to school. I know there are tons of parents that are ready for their kids to go back to school. So those things are being used as motivators, but it depends on, can we get from 34% to 70%? And that's the other challenge with how to really enforce the guidance that came down from the CDC today. Do I think scientifically the guidance makes sense if you're fully vaccinated? Sure, and you're around other fully vaccinated people? Yes. However, you've got to be fully vaccinated. And fully vaccinated means full dose of vaccine. So if it's Pfizer or Moderna, 2 shots. If it's a Johnson & Johnson, 1 shot, plus 14 days.
Mm-hmm.
It's not just those shots and then you're running out of the vaccine site and you're like, I'm fully vaccinated, I can do anything. No, plus 14 days. And so the challenge that we have is, how do you enforce that guidance? I'm thinking about it from the vantage point of being at the supermarket. Will I take off my mask at the supermarket? Well, probably not, because I don't know who around me has been fully vaccinated. And even more dangerous, I don't know who around me hasn't. And so I could be a risk to them. So that's the challenge there, is how do we get, again, to 70%? And that is going to be tremendous. It's going to be a really intensive couple of months trying to make sure that we can do that work. But the challenge of 2 shots plus 14 days, or 1 shot of the Johnson & Johnson plus 14 days, is actually really difficult for people to keep track of. I've noticed even now, where folks have said, well, I got my 2 shots. I think it was about 2 weeks ago. I think I'm vaccinated. So it's difficult to enforce unless we're going to be a lot more diligent.
Just thank you so much. Just for the few moments that we have, I want to deal with something. So we know that the key is to get people fully vaccinated, right? Now, some people may feel that, just because I don't wear a mask, that may mean that I'm fully vaccinated. Do you think we're going to have like a scar on our forehead or some kind of band that walks around and says, hey, I'm fully vaccinated, or wear our card on our t-shirt or something? Or is it just going to be solely based on the responsibility that you as a citizen is caring for your loving your neighbor as Jesus Christ have said?
It's going to be the latter. If there's one thing I've learned about Americans, they do not like to be told what to do. And that's actually been a very difficult part of this entire pandemic. And so we don't expect to be at a place where, there's a scarlet letter V on your forehead if you're, not vaccinated. But that's what makes it more difficult. I think in most conversations in the years to come, you're going to have people saying, are you fully vaccinated? I am fully vaccinated. Did you get your booster? I haven't gotten my booster yet. Those kinds of conversations are going to emerge because we're working on the trust system here. The difference is we're working on the trust system and the consequences can be fatal. So how do we do this in a way that respects, honor and individualism and all of those things, but also can keep people safe? And, a lot of people are holding on to their CDC vaccination cards, and they should. But as of now, there's no plan to use that card as a confirmation in most spaces that you may go in within your city or within your state.
Thank you so very much. Now, I know we have some people that watch movies and they see Contagion and they see the Bourne Identity, those kinds of. Do the vaccines contain microchips that track people?
No, they don't. I finally about 2 weeks ago figured out where this came from. This is one of those, I've heard microchips. I've heard 5G, like somehow it's supposed to like
Yeah.
connect you to a tower. It doesn't contain any of those. So, we talked about the components of it earlier. What it does contain are what's called nanoparticles. And for a small portion of my time in biomedical engineering research, I actually worked on developing nanoparticles. What they do is they are truly nano-sized particles that help your body to deliver things into the body. So those nanoparticles are, imagine, if you could, droplets or bubbles.
Mm-hmm.
And inside of that bubble is the mRNA vaccine.
Mm-hmm.
They're just microscopic. That's what's in the vaccine. And I think somehow some Facebook scientist heard nanoparticle and said microchip, that's what it must be. But no, there are no microchips. But instead of just saying no, that's not the case, I did want to explain what is in there, because I do think, a big part of dispelling misinformation is addressing it with the truth.
Here goes another question that comes from Facebook doctors. Okay.
Mm-hmm.
Does the vaccine alter your DNA?
No, it doesn't. And it's very simple as to why. The vaccine doesn't get anywhere near your DNA to alter it. Your DNA is housed in the nucleus of your cells.
Mm-hmm. Mm-hmm.
When the vaccine goes into the cell, it does not get anywhere near the nucleus of the cell. It actually goes towards what are called ribosomes, which turn that vaccine into a protein. That's technical details. What it means is if you're in a cell, here's the nucleus, the vaccine is all the way over here. It's not even going near your DNA.
So one other question, because I hear this a lot. Does the vaccine cause infertility?
No.
Okay.
No.
It does not.
That seems to be the sole, and it's really interesting. None of my colleagues can track where this came from. There is, however, data that does suggest that pregnant women who've been vaccinated can transfer immunity to their newborns, which is important to consider if you're thinking about having a newborn in the middle of a pandemic. But no, the vaccine has not been shown to cause infertility, interfere with a woman's ability to conceive, a man's ability to produce fertile sperm. None of those things have been shown by any data to date.
All right. So just as a last note, is there anything else that you would like to share with us that you believe that is important for those who are tuning in tonight?
Absolutely. So I think it's important to remember that while vaccination is a personal choice, it is one that affects your family and your community. As with many things, we do not live on islands unto ourselves, and we're not going to be able to make sole decisions for ourselves or our health without impacting the people that we love and care about, and that may be connected to us, whether that be in an apartment building or physically connected to us in a neighborhood or connected to us by blood or by choice. So make the decision that is right for you and for your family, but also consider and be aware of the fact that not only is there the ability to get vaccinated, should you be infected with COVID, there are treatments that can also make sure that you have the best chance of surviving COVID. So if you choose not to get vaccinated now, or if you get infected with COVID before you're fully vaccinated, it's important to know that there are monoclonal antibody treatments that are available. They are free, just like the vaccine is free, that can be made available to you to help your body fight COVID and to make sure that you do not get to hospitalization or ICU care due to the infection.
So now, for someone who is fully vaccinated, what other things can they do to, say, build their immune system, protect others from what do they need to be doing?
So as with other things. We think about what it takes to remain healthy. We think about, keeping your body mass index or just your weight at a healthy and controllable level. If you have chronic diseases, making sure that they are well controlled, which means if you have hypertension or high blood pressure, you're taking your medicine at the right dose, at the right time of day, and that you're not, forgetting to take your medicine or not taking it for days at a time. Same thing with other chronic conditions. If you do not have chronic conditions, doing everything that you can to make sure that you do not end up with chronic conditions because you are not taking care of your body, you are not taking care of your health. So those are the most important things to do. Other precautions that we have seen in the last year, and it's been shocking to some of us how infrequently people wash their hands. For example, continuing to wash your hands when you go in and out, making sure that when you can't wash your hands, you're using sanitizer. Sanitizer is not a substitute. So if you can wash your hands, you're washing your hands. But if you're not in a position where you can do that, using sanitizer, also maintaining appropriate distances. Again, we don't know who's vaccinated and who's not, right? So making sure that while you are considering your own health and making sure that you're controlling your own health, that you may not pose a risk to others.
Great. Now, somebody right now who have been tuned in from beginning to now may say, Doctor, you are a trusted voice to me. I've heard what you said. Your voice is someone I want to trust. How will they be able to, keep in touch with you? Is there any way they can, read up more about your company and anything else that you are doing? How can somebody stay connected? Because now I'm sure they're saying it's a trusted voice. Now I want to be able to stay connected.
Sure. So our team is always manning our hotline. We have a website, healthcareready, one word, .org. We have a Facebook page. We're also manning that if you have questions. And that page also has the hotline as well as an email address where you can find us at any time, whether it be a pandemic, a hurricane, or something else. We will likely be activated in the midst of a response.
Listen, Dr. Nicolette, thank you so very much for your time. You have given us some valuable information. You see the website right there for those of you, healthcareready.org. Please like the Facebook page, Healthcare Ready. Stay connected, stay informed. Here is what the Apostle Paul says. The Apostle Paul says, I do not want to have you ignorant, brethren, right? Which means I want you to stay informed. I want you to have information. I want you to be wise so that you can make the better choices that you will need in order to live better, healthier, bolder, and brighter. And this isn't just Bible. This is just for life in general. So this is why we've had this candid conversation with Dr. Nicolette Louissaint. And we are so grateful to God for that. So listen, I want you to just stay right where you are. I just want to tell everybody, thank you so much for tuning in on tonight. I'm sure you had a wonderful time. Don't you still have an opportunity to hit share? So make sure you share this so somebody who's scrolling on your page will stop and say, who is this beautiful young lady talking? I want to get to know who she is. You got to go through her daddy first. But listen, thank y'all so very much. Dr. Nicolette, thank you for your time. Just stay. I want to say a couple of things for you, but all of you, good night. Just make sure you tune in 12 to noon, Refuge Church of God. We are Sunday on live. You have an opportunity to join us in person as well. Doors open at 11:30. Can't wait to see you either in person or online. God bless you. Have a wonderful night. Bye-bye.